in rural India is a silent one. The second wave of pandemic hit rural districts hard in 6 districts in the month of May, and rural India accounted for more than 50% of COVID-related deaths and cases. Sneha Murdani with this report.
The second wave of the pandemic has hit rural India hard, harder than what we thought it would. Data suggests that rural India was worst hit by the second wave compared to urban centers. A study by the Center for Science and Environment says that in the month of May, over half of the daily total cases happened in India on 6 days, and this was triggered due to a surge in cases in rural districts.
The ICMR guidelines on accounting for deaths due to COVID have not been followed. It is likely that COVID-19 is the underlying cause of death caused by pneumonia.
52% of deaths due to COVID-19 happened in rural India in May. 53% of cases were reported from rural India. Migration and internal displacement have also occupied the center stage once again. The report has also exposed the gaps in India's healthcare infrastructure.
Country needs at least 38% more community health centers, which is the first level of health infrastructure where rural people get access to specialist doctors and allied staff like radiographers.
Union Health Ministry sources do indicate that there is a problem as far as sharing of the data is concerned, because data on cases and deaths of COVID-19 is shared on the basis of how many districts are reporting which cases. There could be a chance of us not really understanding the magnitude of the problem in rural India. Perhaps there needs to be a relook and a rethink as to how data is demarcated, and this maybe needs to be done on the basis of rural India and urban India for a better understanding of this crisis unfolding in villages in the country. In New Delhi, Sneha Murdani for India Today.